Okay, so let's talk today about anesthesia. So anesthesia is one of the main things that keeps patients from having surgery, and it's understandable. A lot of them are concerned about it. There are different types of anesthesia. There is local anesthesia, where basically the patient is completely awake. We just inject lidocaine or other type of local anesthetics. There is a combination of local anesthesia with some oral sedation, which usually includes a narcotic and also either a Valium or another Ativan or medications to relax the consciousness a little bit and take away the anxiety. In both cases, the patient is still awake and responsive. There is another level of IV sedation where it's conscious sedation. So now you give medications through an IV, but the patient continues to be still awake. He can respond to questions. If you ask them to move, they will move. There's then a deeper type of sedation where it's like a monitor anesthesia care or a MAC. And those patients usually are under some propofol and they're a little bit less responsive, but they don't require to be intubated. We're doing this organic. We have some noise outside. We have general anesthesia, which is what we use for major cases, and that requires the patients to be intubated. So the chances for anesthesia or having problems from anesthesia is actually less than the chances of getting into an accident, in a car accident, and that has been studied, scientifically and with actual statistics and real data. And here sitting, I'm of course not an anesthesiologist, but I'm sitting where the anesthesiologist would be sitting, which is usually behind the operating room table, and they used a machine here where the patient basically receives their medications, but they also get monitored with different monitors to monitor their heart rate and stuff like that. And usually I'm operating on that other side of the table, and we maintain communications between myself, the surgeon, and the anesthesiologist. I think it's very important for patients to see this so that they have a better understanding of what really goes in the operating room, and they realize that if you're healthy, the chances of you having issues from anesthesia are very slim. It's very important from my part, the doctor's part, and the anesthesiologist's part, to make sure that patients are in fact healthy. So in our office, we do a medical history, surgical history, and we also send patients based on some guidelines to go to the primary care doctors to do a pre-surgery clearance or risk analysis, or just basically a clearance to make sure they're fine for surgery. And I think it's important just for you guys to see this.